Certain disorders in today's times like COVID has also led to a lot of patients coming to me with the problem of hair loss. Most important cause is genetic baldness. Hi everyone, I am Dr. Shalini Malhotra. I am a hair transplant surgeon and consultant dermatologist practicing in New Delhi. Let's talk about the causes of hair loss. Hair loss could be due to various causes. First and foremost is decrease in your hemoglobin level, which is known as anemia. It could be due to hyper or hypothyroidism. It could be due to stress. Stress is a very important factor which leads to hair loss, so you need to keep that in check. You have to manage stress. Avoiding stress in today's time is a very difficult thing. Managing stress, yes, you have to learn it. It could be due to some nutritional deficiency of vitamin D. Calcium can cause hair loss. You have to have a good, proper, nutritious diet. You have to visit your doctor and take proper supplementations to prevent hair loss. Hair loss could be due to conditions known as alopecia areata, where you lose some patches of hairs from various areas of your scalp. These patches generally come back, but sometimes you need treatment to get these hair back. You can also experience hair loss due to some other disorders, which is known as alopecia universalis, or some syndromes in medical field which can lead to hair loss. Some medications like antidepressant medications or medications which is used to treat cancer, which is known as chemotherapy, that can also lead to hair fall. Certain disorders in today's times like COVID has also led to a lot of patients coming to me with the problem of hair loss. Most important cause is genetic baldness. Genetic baldness is one of the most common causes which leads to not only hair loss but complete baldness of the scalp. Coming to the treatment, well, you have to visit your doctor first of all, not do self-medication. Once you visit your doctor will diagnose the reason for your hair loss and will suggest the various treatment modalities which is particular to the kind of hair loss you're having. Let me talk to you about genetic baldness. Genetic baldness can be controlled, or the progression of genetic baldness can be delayed with some medications. For example, minoxidil and finasteride. These two medications are FDA approved for managing genetic baldness. However, you need to understand that these medications will provide a temporary treatment or temporary modality to control your baldness or delay the progression. But if you want a permanent treatment, you have to consider hair transplant. Hair transplant is a simple surgical procedure which can restore the grafts which you have lost due to genetic baldness. This procedure is done under local anesthesia, in which we take out hair from the healthy area of your scalp, which is the back of your scalp, and we implant these hairs or grafts, which is also known as grafts, in the front area of your scalp, which is the bald area of the scalp. If done by a properly trained and experienced surgeon under sterilized atmosphere, this procedure is one of the safest surgeries of the medical field, where chances of side effects are as good as being zero. But you have to visit the proper doctor for that. That is very, very important. Apart from hair transplant surgery, there is no other modality which can permanently restore the lost follicles in genetic baldness. Rest of the reasons of the baldness which I have talked about, they have various other modalities of treatment. For example, there is something known as platelet-rich plasma therapy, which is PRP. In PRP, we take out some amount of blood from your body and we extract platelets from that blood sample and then again inject those platelets in the roots of your scalp. That is one modality that can help in controlling hair loss. Minoxidil and finasteride can again be useful in controlling hair loss due to other reasons. You have to control any systemic diseases which you have, that needs to be controlled to control hair loss. The medications causing hair loss need to be discontinued. Your nutrition parameters have to be apt. You have to take supplements and a proper diet. You have to do some yoga or some meditation to manage your stress. You can also go for mesotherapy, which is injection of proteins in the scalp. You can go for some laser therapies in which laser cap or laser comb is used to manage your hair loss. Again, like I mentioned earlier, the treatment for your hair loss depends on the reason of your hair loss. So what kind of treatment you need to take can be advised properly only by your doctor. So please visit your doctor today and understand what is causing your hair loss, and then follow the advice which your doctor gives you to manage that hair loss. Thank you.